This audio presentation was pre-recorded and edited for brevity and clarity.
Hello and welcome to today's BrightFocus Glaucoma Chat. My name is Casey Baez, and on behalf of BrightFocus Foundation, I'm pleased to be here with you today as we discuss Glaucoma 101, exploring the science behind the sight-stealing disease. Our Glaucoma Chats are a monthly program in partnership with the American Glaucoma Society, designed to provide people living with glaucoma and the family and friends who support them with information straight from the experts. All vision chats presented by BrightFocus are also available to listen to as podcasts on the go on YouTube, Spotify, iHeartRadio, Amazon Music, Apple Podcasts, and Pandora. BrightFocus Foundation's National Glaucoma Research program is one of the world's leading nonprofit funders of glaucoma research and has supported nearly $51 million in scientific grants exploring the root causes, prevention strategies, and treatments to end this sight-stealing disease, and is currently supporting 38 active research projects across the globe in the quest for a cure. Now I would like to introduce today's guest speaker. Dr. Chi Cui, MD, PhD, is a board-certified and fellowship-trained glaucoma specialist at the Shea Eye Institute at the University of Pennsylvania. She attended medical and graduate school at the University of Rochester Medical Scientist Training Program and completed an ophthalmology residency at the University of California, San Francisco, followed by a surgical glaucoma fellowship at Wills Eye Hospital. Dr. Cui is involved in both clinical and basic science research. The Cui Lab seeks to understand pathogenic mechanisms contributing to glaucoma and seeks to identify novel therapies for glaucoma. Welcome, Dr. Cui. We're so excited to have you here today with us.
Thank you, Casey. It's a pleasure to be here today.
Thank you so much. So we'll just dive right in. Most everybody on the call is familiar with glaucoma, but could you just start us off with an overview of what is glaucoma?
Sure. Let me give you sort of the textbook definition to kind of start off with. So glaucoma is a heterogeneous group of eye diseases, all with characteristic changes to the optic nerve as a result of loss of retinal ganglion cells, which are neurons of the eye. And this results in progressive and unfortunately often permanent vision loss.
And how do you know if you have glaucoma? At what age is it most prevalent, or should you get screening?
Yeah, so that's the difficulty with glaucoma in many instances. Glaucoma is often called sort of the silent thief of sight. And by that, we mean that a lot of people who have glaucoma, especially early glaucoma, or high-risk glaucoma suspects, do not know that they have glaucoma. And here is where early screening and going to an eye doctor to get examined, so someone can look at the back of the eye and look at the optic nerve and look at the retina is really important. Glaucoma tends to be more prevalent as we get older. So it is one of the risk factors associated with glaucoma is age. So as we get older and older, glaucoma becomes much more prevalent in the population. So in somebody who is 30 years old, glaucoma is not very prevalent, but by the time we get to 80 or 90 years old in certain populations, it can be 5 to 10% of the population. So the take home here is get screened early. We recommend yearly eye exams in general, but particularly if someone has a family history of glaucoma or you're aware that you do have a risk for glaucoma, then get screened early and get regular follow-ups.
Thank you. And so in terms of how glaucoma works, what part of the eye is affected by glaucoma? And does glaucoma affect your central vision when you have severe glaucoma?
So in terms of which part of the eye is affected by glaucoma, as I already mentioned, the cells that are affected by glaucoma are called retinal ganglion cells. and they reside in the back of the eye in the retina. So the retinal ganglion cells are the innermost layer of cells in the retina. So after dilation, when someone goes to my office and I look in the back of the eye, the innermost layer of the retina is the retinal ganglion cells. I don't see the cells, but sometimes I can see the axons of the cells, which all come together to make up the optic nerve. So that is part of the eye that is actually affected by glaucoma. Having said that, however, sometimes the pathophysiology of what causes glaucoma, what causes the pressure inside the eye to elevate, has to do with the front of the eye. And that's part of the eye called the angle. So the drainage angle is where the fluid, which is the aqueous humor inside the eye, naturally drain out of the eye. And if the angle is not open, not patent, there's something occluding it, then the pressure inside the eye can elevate, and that is a major risk factor for glaucoma. In terms of whether glaucoma can affect your central vision when you have severe glaucoma, unfortunately it can. In the majority of glaucoma sufferers, it does not affect central vision until later on in the disease process. But in a subset of glaucoma, typically associated with what we call normal tension or low tension glaucoma, central vision, or sort of the part of the vision that's responsible for reading and for high acuity vision, can be affected a little bit earlier.
So you mentioned low tension glaucoma, and so understanding that glaucoma is a group of different types of diseases that come with different risks and maybe affect different people differently. Could you provide us with an overview of what are the different types of glaucoma and how do we distinguish from each of them?
Yeah, absolutely, happy to. Broadly speaking, glaucoma is divided into open angle and angle closure glaucoma or closed angle glaucoma. And what that means is we're referring to the part of the eye that's called the anterior chamber drainage angle that I was sort of just referring to. So this is the part of the eye where the aqueous humor, which is the fluid that is produced by our eyes, naturally drain out of the eye after it's sort of done its job. If that angle is occluded, meaning that we don't have a clear visualization of the anterior chamber drainage angle, then we talk about angle closure or closed angle glaucoma. If that angle is broadly open, then we talk about open angle glaucoma. So those are sort of the two broad types. And the way we can tell whether somebody's at risk for open angle glaucoma versus angle closure glaucoma is by doing an examination technique called gonioscopy. And what this is we use a prism lens on top of the eye that will allow us to look into the angle and see what the architecture of the angle looks like. If the angle looks narrow or potentially occludable, then we're a little bit more worried about closed angle or angle closure glaucoma. If they look nice and open, but someone does look like they have other risk factors for glaucoma on either examination or medical history, then we're a little bit more worried about open angle. Now, there are different subcategories of particularly open angle glaucoma, such as pseudoexfoliative glaucoma, pigment dispersion syndrome. So broadly speaking, though, we characterize glaucoma based on the structure of the angle.
Okay, thank you. And so are some people more at risk than others for these different types of?
Yes, absolutely. That is unfortunately the case, that some people are more at risk than others for different types of glaucoma. Certainly when it comes to angle closure or closed angle glaucoma, if someone has a more narrow angle, then they're at risk for that category of glaucoma. as many of you probably already know, glaucoma unfortunately does have a genetic component, and there are a lot of genes that's been characterized to potentially confer higher risk for open-angle glaucoma or closed-angle glaucoma. There are also systemic diseases and risk factors, personal risk factors that are associated with glaucoma, such as high and low blood pressure. Diabetes has been shown to be a risk factor for glaucoma. Sleep apnea, cardiovascular disease. A lot of these systemic risk factors can cause somebody to be at higher risk for glaucoma as well. And here, once again, it's important to see an eye care provider so they can evaluate not only the eye, but these systemic and potentially genetic risk factors. The other thing is if there's a family history of glaucoma, then somebody might be at higher risk for glaucoma, and that is something that's important to make the eye care provider aware of as well.
Thank you. It's always important to understand your family history when it comes to health, and to be open and honest with your medical care provider, because everybody else, everybody's different. So go get your eyes.
Absolutely.
That's an important message. And so in the world of glaucoma, why is elevated intraocular pressure, or IOP, something to be concerned about? And do all people with glaucoma have elevated IOP?
Yeah, that's a great question. If someone has been to the doctor's office and has been evaluated for glaucoma, you probably heard the term elevated intraocular pressure. And the reason for that really stems for this study that was conducted first in 1994, the ocular hypertension treatment study. In this study, patients were randomized to either receive intraocular pressure lowering medication, or to not receive intraocular pressure lowering medication, and they found that about a 20% reduction of intraocular pressure halved the risk for developing glaucoma over the course of 5 years. So this study, and it is still ongoing, really informed our understanding of the treatment of glaucoma, namely that elevated intraocular pressure is a modifiable risk factor for glaucoma. So many of our treatments, whether they are medical, surgical, laser, by and large aim at lowering intraocular pressure. And so that's why we talk about intraocular pressure a lot, and we talk about lowering intraocular pressure. As to whether everybody has elevated intraocular pressure who have glaucoma, that is not actually true. There is a subcategory of glaucoma, as I already mentioned, called normal tension glaucoma or low tension glaucoma, where when we check the pressure inside the eye in these patients, the pressure is not considered high. So they're typically under 21 millimeter mercury. But we do see evidence of glaucoma. And this is an important distinction, because it does not mean that if someone has normal intraocular pressure, quote unquote, that they do not have glaucoma. It really depends on the rest of the exam and their other risk factors associated with glaucoma. Incidentally, there has been a different study looking at this subpopulation of patients, and this also found that even though pressures are normal in these normal tension glaucoma patients, lowering intraocular pressure also decreases their risk of having developed glaucoma and glaucoma progression.
It's an important example of the complexities of this disease and the many factors at play. So
absolutely.
We often get some of the same questions during these programs, and our listeners. And one question we got for this program that I know we've discussed before, but we want to address it again because these are really important questions. And then it's, will I ever totally lose my sight by having glaucoma? And it's sort of connected to the question of what happens to our vision as glaucoma progresses.
Yeah, that is a good and important question. You know, glaucoma can cause complete blindness, unfortunately, but it does not cause that in everyone. As we already talked about, everybody's risk for glaucoma and glaucoma progression is different. So the appropriate treatment for everybody and what they need in order to prevent the glaucoma from progressing is also different. So yes, can glaucoma cause people to completely lose their vision? The answer is unfortunately yes. But will glaucoma cause everyone who has glaucoma to lose vision? The answer for that is definitely no. I apologize, Casey. Can you remind me what the second part of the question is?
Oh, sure. And just thinking about, you know, what happens to our eyesight as glaucoma progresses. I know you mentioned it's different for everyone.
It is different for everyone, and it's one of those experiences that, you know, can be difficult to characterize, you know, for people who have not experienced it. You know, George Space and other physicians at Will's Eye have done a lot of good research on this topic in terms of what is the symptoms experienced by glaucoma patients as their glaucoma continue to worsen. A lot of times what we talk about is loss of peripheral vision, and this results in a quote-unquote tunnel vision. You know, in some of the studies that Dr. Space and his cohorts have looked at, what they've shown that this is not entirely the case. What can happen is that people start to lose sort of contrast sensitivity. And what that means is, you know, the different colors seem a little bit less vivid. The details become a little bit fuzzier. You know, they need more light to be able to see. Overall, things become, you know, for a lack of better description, more washed out. That can very well be the experience of some of these patients who are suffering from glaucoma. But as glaucoma become more severe, people can develop scotomas, and that means parts of the vision where they're not able to see through as well, that looks either black or gray. That can certainly happen, and that's more noticeable when they're closer to their central vision. But ultimately, it's a little bit of an amorphous change to their vision, and because it happens so gradually, not everyone appreciates it as an acute change, and this can make glaucoma a little bit harder to diagnose and to notice, even when it is already approaching the severe stage.
Thank you. And so some other questions that we get that are pretty popular amongst people interested in glaucoma or people who have glaucoma is, can vision loss to glaucoma be restored? And that, you know, can the damage to our optic nerve be reversed?
Yeah, that is, you know, as I mentioned, I do basic science and clinical research in glaucoma as well. That is something we're all striving for. You know, that is the holy grail. We would love to be able to restore lost vision in glaucoma and other eye diseases as well. As of right now, we do not have a way to restore retinal ganglion cells and regrow retinal ganglion cells in the eye after they have been damaged and they have died. And because of this, unfortunately, the answer is that we are not able to restore lost vision as of right now in glaucoma. But there are a lot of active research going on in terms of vision restoration. trying to regrow retinal ganglion cells and encourage their axons to go through the optic nerve and reconnect with the brain, allowing us to pick up visual information once again and send it to our brain. And I am hopeful that in, potentially the next 5 to 10 years, we will have made very good progress along those lines.
And there are treatments available for glaucoma that many of our listeners may be familiar with. We've had entire episodes on glaucoma treatments, but could you briefly summarize the types of treatments that are currently available for glaucoma?
Yeah, absolutely. Happy to do it. In terms of treatment for glaucoma, broadly speaking, we have medical treatment, we have laser procedures, and we have surgical treatment. And medical treatment, many of our listeners are probably familiar with this, are typically eye drops. So these are different classes of medication that's been formulated as an eye drop to be applied directly to the cornea. And the goal for all of these medications is to lower the pressure inside the eye. And this is done by encouraging the aqueous humor to either flow throughout the angle more effectively or flow through parts of the eye and through the lymphatic drainage more effectively, or else to encourage the eye to produce less aqueous humor and thereby decreasing the pressure inside the eye. Laser procedures, the specific ones that I'm thinking of are selective laser trabeculoplasty or argon laser trabeculoplasty. These lasers are applied directly to the drainage angle, and this results in basically restructuring of the drainage angle matrix, cellular matrix in that area, to encourage drainage of the fluid from the angle. And this can be done in the clinic, and it typically is done, with the same level of effectiveness at about 1 to 2 eye drops. And finally, we have surgeries. Once again, the purpose of these surgeries are to lower the pressure inside the eye. And this can be done by either directly targeting the drainage network, by opening up the drainage network a little bit more, allowing the aqueous humor to flow out of the angle, or else by creating an alternative pathway for the fluid inside the eye to drain out of the eye into the connective tissue around the eye. So those are, broadly speaking, the different categories of treatment options, and they can be very effective for a large proportion of glaucoma patients.
Thank you. In terms of treatment, many of our listeners are curious about how maybe lifestyle interventions such as diet or nutrition or different types of healthy lifestyle factors, how do those play a role in glaucoma disease management or risk reduction? One of our listeners has also inquired about plant-based foods and glaucoma.
Yeah, that's a great question, and we are still learning a lot of information, new information as far as that's concerned. As we had already talked about, certain systemic diseases like high blood pressure, diabetes, sleep apnea, cardiovascular diseases can cause a higher risk for glaucoma and glaucoma progression. So, certainly making sure systemic diseases are well controlled is helpful. In terms of plant-based diet, I think there is a significant amount of evidence out there to suggest that leafy green vegetables and a diet that is rich in antioxidants may be beneficial for glaucoma. And the reason for that is there is a whole class of literature looking at oxidative stress as a cause of glaucoma. And there are a lot of literature suggesting that by decreasing oxidative stress, we may be helping to prevent progression of glaucoma and worsening of glaucoma. And, leafy green vegetables certainly have a lot of antioxidants in them. So, having a healthy diet, low inflammatory diet can certainly be helpful.
Feels like everything is connected to inflammation. So
it can
thanks
be,
for yeah. Love leafy green vegetables, and BrightFocus also has recipes for healthy eating for brain and vision health on its website at brightfocus.org. But so I know that your lab is dedicated to finding new treatments for glaucoma. Could you tell us a little bit about your current work and the association between glaucoma and neurodegenerative conditions?
Yeah, I'll be happy to. So, in my lab work, our current focus is on a class of medications called GLP-1 receptor agonists. And that's a mouthful, but many of you will have heard of its sort of generic name, which is Wegovy and Ozempic and semaglutide. So this class of medication has been getting a lot of press lately for weight loss, and it's also used to treat diabetes. What we found in our lab, and others as well, is that this class of medication decreases neural inflammation inside the eye. And what sort of prompted us to sort of look at this is they have also been looking at this class of medication for treating neurodegenerative conditions like Alzheimer's, Parkinson's disease, and Huntington's disease. And we have identified similar pathways between our animal models of glaucoma and some of these neurodegenerative conditions. Now, they're obviously not the same disease, but some of the pathways specifically related to neuroinflammation are similar. And what we've shown is that GLP-1 receptor agonists may serve to decrease in neuroinflammation or inflammation inside the eye in response to elevated intraocular pressure. And this could potentially be a viable treatment for glaucoma. Now, lots of work still remains to be done, and we are looking to see whether we can develop this into a clinical trial. But I think the initial information or the initial studies are relatively promising. And then the second thing that we've looked at is, looking at existing health database information to see whether there's any connection in the use of this class medication for treating diabetes and risk for glaucoma. What we found is that, type 2 diabetic patients who are using GLP-1 receptor agonist medications as opposed to different kind of diabetic medication appear to have lower risk for developing glaucoma. So that's also a piece of information that suggests these medications may be beneficial. So, I'm very excited by this work. Whether or not this ends up being a treatment that we can rely on for glaucoma remains to be seen, but I am hopeful.
That's really exciting, and research can take a while to see the benefits, but I think if you look at the course of history, research does pay off, and so there's a lot to be hopeful about in vision research, and thank you for diving into that. And BrightFocus has funded a lot in the space devoted to neurodegeneration because it's sort of all connected. And so what are you most excited?
Absolutely.
Yeah, it's all connected. So fascinating. And so what are you most excited about in terms of promising glaucoma research for a cure?
Oh, that's a good question. I'm really excited now that we have basically two general avenues of research. My lab focuses on neuroprotection, right? So our goal is to prevent glaucoma from getting worse. But there are a lot of other researchers, other labs out there looking at neuroregenerative pathways. So not only are we trying to prevent glaucoma from, becoming evident and progressing, other researchers are also looking into whether they can restore vision after glaucoma has already caused some damage. So I think those avenues of research are really important, and they will work in combination with each other to hopefully sort of advance our understanding of glaucoma. Personally speaking, I feel there's a lot we still don't understand, even as somebody who treats glaucoma, about glaucoma. And the research along that field has never been so robust. And I'm really excited to see what we're going to find in the next 5 to 10 years. So I think there's a lot of promise.
That is so exciting. There's so much in the pipeline. So thank you for everything you've shared with us. Yeah, it's been so informative. When you have a condition like glaucoma, to just get as much information as possible. We have a few more questions before we wrap up. Just a couple more that I'd like to ask just before we jump off. And so one question is, can you have glaucoma in only one eye?
Yes, this can happen. In fact, in a lot of people, glaucoma severity is asymmetric. Many of my patients have glaucoma that's affecting their vision in one eye, and in the other eye, they may only be a glaucoma suspect, which means that, we're watching that eye carefully, but they do not have glaucoma that is affecting their vision as far as we're aware of. The difference between somebody who's a high-risk glaucoma suspect and a glaucoma, it's a fine line. A lot of times, because glaucoma takes a number of years in a lot of people to manifest themselves, we may not know if somebody will ultimately develop glaucoma as they get a little bit older. So they will sort of remain in that glaucoma suspect category until and when, if the glaucoma sort of manifests itself. But certainly glaucoma can be asymmetric, and especially in those who have other cause for glaucoma. For example, trauma, prior ocular trauma can cause glaucoma. And if the trauma only occurs in one eye, then that would be the eye that's affected, and the other eye can be perfectly healthy.
It shows the importance of getting that eye exam because everyone is different. Thank you. And one more question.
Yeah, absolutely.
The vision is, so what makes my vision go dark and then get light again? Sometimes there's also a cloud or fogging, but it goes away.
Yeah, so if this is so a lot of things can cause these sort of visual changes that people experience. If we're to assume that this is due to glaucoma, which it may not always be, but if we're to assume that it's due to glaucoma and severe glaucoma, then it could be related to the general health of the retinal ganglion cells. The retinal ganglion cells can be damaged, but they can still be functioning. So sometimes what can happen is their functional ability, the way they're functioning, carrying information from the front of the eye to the brain, can wax and wane a little bit, and that can cause some of this fogginess and change in vision, darkening that someone is experiencing. Having said that, I will just say a lot of things that's not related to glaucoma can cause these kind of visual changes, so it may not be directly attributable to glaucoma in all cases.
Always important to discuss your symptoms with your healthcare provider, but thank you for that information.
Absolutely.
And so we have one more listener submitted question. This is actually a really important question. I think we could probably spend a long time talking about it, but the question is, at what point does glaucoma become a disability?
Oh gosh, that is a really good question. And you're right, we can probably spend a lot of time talking about that. I think from my perspective, when I talk to my patients about this, is it really depends on their personal needs, right? So we talked about eye diseases, or I should say, we often talk about eye diseases affecting our activities of daily living, right? So, everybody's daily needs of what they need to do to get through the day and how they sort of conduct their life is different. So someone can have very low visual needs, in which case glaucoma may not become a disability ever, even if it's relatively severe, when somebody else has very high visual needs and their glaucoma can become a disability because it disrupts their life, even when it's relatively mild. So I think it's a hard question to answer in that sense, but I do think there's a personal component to that. And ultimately, if the glaucoma is affecting your life in a way that prevents you from doing what you need to do on a daily basis, then you can argue it is debilitating for you. So it may not be a disability in the strictest sense of the word, but it can be debilitating for an individual person, even when the glaucoma is mild.
So important, just an important reminder that everyone is different. And once your life is impacted, it just becomes a whole different ballgame. Thank you, Dr. Cui. Do you have any final thoughts to share with our listeners today?
Yeah, we talked a lot about this already, but glaucoma is one of those diseases that is unfortunately incredibly frustrating, and it can be seemingly difficult to control for some patients. But just keep in mind, please, that not all glaucoma are created equal, right? Some people will unfortunately lose vision because of glaucoma, but other people can, do very, very well, and their glaucoma can be put under excellent control. The way to make that happen is, just follow up with your eye care provider. Make sure you go to regular appointments, discuss your symptoms and your concerns with your eye care provider. And that's the way to ensure we're able to provide you with the glaucoma care that is needed for each individual. But we talked about that a little bit already today.
Absolutely. Just remember to communicate and ask questions. Such important information and insight that you shared today. Dr. Cui, thank you so much.
Thank you so much.
Yeah, so informative. And to our listeners, thank you so much for joining our Glaucoma Chat. We sincerely hope that you found it helpful. This is our last Glaucoma Chat for 2024. We look forward to next year and joining you on Wednesday, January 8th. Thanks again for joining us today, and this concludes today's BrightFocus Glaucoma Check.
The information provided in this recording is a public service of BrightFocus Foundation and is not intended to constitute medical advice. Please consult your physician for personalized medical, dietary, and/or exercise advice. Any medications or supplements should only be taken under medical supervision. BrightFocus Foundation does not endorse any medical products or therapies.